We're thankful that you're here with us today. Is it 12 o'clock your time? 12 o'clock in California. My co-presenter, Sarah Hybels, is here with me. We are in Iowa, so we're in the Midwest. And so we're just coming into that afternoon slump, but we are glad that you are here today. Again, everyone's cameras are turned off, muted, but please feel free to interact with us in the chat. We'd love to answer questions and discuss things with you. Hybels will be monitoring that, or I'll be monitoring that as we go through. So we want to first get started and acknowledge that this is a sensitive topic today. There may be some emotional aspects for you, and we just encourage you to prioritize your well-being. It's totally okay to step away from the conversation. It will not hurt our feelings at all. We are going to send out a recording of this webinar. We'll send out the slides so you can engage in it at a time that's good for you. We'd also like to thank the California St. Agnes Health System. We're grateful for their partnership in bringing this information to you today. And our contact, Helen, I don't see her yet here with us, but she is a force of nature. We're grateful for her moving things forward and getting this opportunity into the hands of the people in Fresno County. So I'm Sarah Coleman, and I'm the State Expansion Director here at Healthy Birthday. And my job is to make connections with the communities and to make sure that the deliverables that we do as a part of our contracts are meeting the needs of those who are using them. And so I'm excited to be here. I bring a background in a couple different areas, nursing and education. And most recently, I completed a master's in public health and maternal child health. So I'm excited to be with you. And I'd like to introduce my coordinator and my co-presenter. I'll let her introduce herself.
Hello, I'm Sarah Hybels. I'm the State Expansion Coordinator with Healthy Birthday. I've been here for almost a year and have a background in victim advocacy and nonprofit work. So my job is to work to make sure all those deliverables that we're sending out to those in Fresno County get into your hands, our materials, our letters. So we're making sure that we're getting our materials into the hands of the expectant parents that you serve.
Thank you. So again, Hybels will be helping me in the chat today. We really do encourage you to ask questions. I would love to dialogue with you and have an opportunity to answer questions in real time. So I'll just kind of keep my eye out and Hybels will flag me. So we're going to start and see how many of you have heard of Count the Kicks as an educational program before we jump into to more about that program. So it looks like we're getting some good answers. We might hit a 50% split here today. Give it just another second. All right. Looks like we had just about everybody answering. Okay, and it looks like we have not a 50 split, 50-50 split, but more like 64-36. So that's great. So those of you who have heard of Count the Kicks, we hope to expand a little bit about the things that in your work that connect to Count the Kicks and help you learn more. And if you're brand new to us today, we plan to take you on a tour. So we'll start out with this video and let's see if my volume will work correctly this time.
We have a healthy baby girl and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the third trimester.
For the ECOFs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
Okay, so we want to talk to you a little bit about Count the Kicks and what our program is all about. So Count the Kicks is a highly effective evidence-based stillbirth prevention program. We were founded about 15 years ago from a group of 5 Iowa moms who all experience infant death or stillbirth. And we've developed a proven early warning system for expectant parents, and we've saved lives in 36 states and 5 countries so far. The program is so easy, it's very plug and play, easy for you to implement and share with expectant parents that you serve. So this webinar is going to give you the tool and the resources in order to spread the word about Count the Kicks with the expectant parents that you serve.
And before I go into these, I just want to shout out to Helen. Helen is here today. And again, a big thanks to the California St. Agnes Healthcare System. Helen, you can wave to us in the chat. We're thankful for your partnership. So before going any further into the statistics, I also want to talk about the tragedy that is stillbirth. Stillbirth is defined by the CDC as the loss of a baby at 20 weeks of pregnancy, and this is a public health tragedy. Stillbirth is a lot more common than individuals think. 1 in every 175 pregnancies will end in stillbirth in the United States. That means around 60 babies a day are born stillborn. Additionally, the disparities that exist are unacceptable, and you can see that here from the notes. It's clear that there are vast differences in the stillbirth rate affecting Black, Indigenous, Native Hawaiian, and Pacific Islander families. So these disparities that exist need to be addressed through systematic change. And let's take a look at the California data. So it's important to our organization to understand the impact of stillbirth both in California and even more specifically in Fresno County. So this information was collected from the California Department of Health Fetal Mortality Dashboard, and there's a link here on the slide. And again, we'll be sending these out to you afterwards so that you can dig into this if you're not familiar with it. But this is this data, we've specifically highlighted the most recent stillbirth data available on the dashboard, which was in 2021. As you can see visually, the fetal mortality or stillbirth rate for the entire state of California in 2021 was 5.34 deaths per 1,000 births, excuse me. It's 2 p.m. The numbers aren't coming to me. So Fresno County actually experienced a slightly higher rate of 5.76 per 1,000 born. So when we drill down even further, you can see some of that ethnicity data that is reflected. We see significantly higher rates for expectant parents who are American Indian, Alaska Natives, Black, or Pacific Islanders. So this trend is also, again, reflected at the national level on the slide that I just showed you. And this alarming reality requires all of us to do our part in addressing the racial disparities that exist and persist in our communities. And the final visual that we wanted to show is, so you see over there on the right with the red arrow, this is pointing at Fresno County, and we mentioned that it has a higher stillbirth rate than the state average. So it's important to note that the 2 bordering counties, which are, I think I'm going to say this right, Madera and Tulare, and if I didn't say that right, I apologize. These counties have a population that is even at higher risk of stillbirth than Fresno County. So just want to call out that this is a highly impacted area of the state. And what do we know about stillbirth? Well, there isn't a definitive cause for stillbirth. Research points to possible causes and contributing factors. You can see some of them listed here. We do want to call attention today. Syphilis has been in the news. This is an older infection that's being diagnosed at the highest rates in 70 years. And it has a huge impact on pregnancy. So if an expectant parent is diagnosed with syphilis, this can spread to the unborn baby, causing congenital syphilis. Excuse me. And if left untreated, congenital syphilis can increase the risk of having a stillbirth. And there has recently been a sharp increase in those numbers of babies that are born with congenital syphilis. And the data is showing us that 40% of babies born to women with untreated syphilis can be stillborn or die from the infection as a newborn. So again, if left untreated, congenital syphilis can increase the risk of having a stillbirth. And so we just want to raise kind of the warning flag and just say you as community health workers, members of your community working with expectant parent populations, you can have an impact, and you can improve birth outcomes and prevent syphilis-related stillbirths by talking with expectant parents about their risk and encouraging them to get tested at their first prenatal appointment. So it's just really important to be aware of things that may have an impact on stillbirth that can be preventable. So what are we doing to reduce the disparities in stillbirth? Here at Healthy Birthday, you can see many things about our organization that we're doing, and I just want to call out several of these. We are focusing on health literacy. We're focusing on making sure our materials are inclusive. We're constantly undergoing evaluation and taking feedback on those materials. We just recently had a massive translation project undergone that completed this week, and our app is now available in 21 languages, and we are broadening the scope of our materials in other languages offered. So alongside that, we want to make sure that we are representing the diverse populations that we serve in our web presence and our educational materials. So we've made changes to reflect that and make sure that our materials mean something to people that are reading them. We undergo continuous internal DEI training, and we collaborate with organizations and thought partners in communities that are disproportionately affected by stillbirth to support and uplift initiatives to improve birth outcomes. So those are just some of the things that we are working on as an organization. I'd like to get into the research behind our program, behind fetal movement monitoring and its importance. This is a best practice in stillbirth prevention. And so where we get our founding information from, this is a study, we call it the Norway study. It was conducted in Norway in 2007. And in this study, researchers worked with health systems, not unlike the California St. Agnes system. They worked with these health systems throughout the country to educate expectant parents on getting to know what was normal for their baby. So thinking about normal movement, tracking that normal movement, and to speak up if they noticed a change. What they understood from research and in storytelling is that a change in baby's movements appeared to be a red flag during pregnancy and could possibly be a precursor. So they were studying this. And what they found is that if they investigate when a baby was in distress, so alert the doctor if there's change in pattern, the doctor could take action or intervene if needed. So this systems change work in hospitals and OB clinics throughout Norway led to a 30% reduction in Norway's stillbirth rate. And Dr. Ruth Fretz, whose name is circled there, she was an original researcher on this program. She today sits on our medical advisory board and advises our work. So our founders, who are based in Iowa, said, you know, this looks like something that we want to replicate. They were all lost parents. They did not want anyone else to experience what they had gone through. And so this campaign got underway in Iowa in 2008. So here is some of the results of that campaign. This is the lifeline this is the life of our campaign with a trend line. That red line at the top represents the national stillbirth rate, and the teal dots and trend line beneath that is our Iowa rate, beginning in 2003 and then going through 2022. So that line right there around 2008, that's where the campaign started. So you can see after that, we have a continual trend line downward. And that is where we showed that 30% reduction. So it's important to note that the US, which is that red line, stayed pretty stagnant. There were times where there's some variation there. We know that we can point to things like a syphilis outbreak, pandemic, different factors like that may have all the difference in the world on that trend line. But what we see is a continual slope downward. And so that comes from the Iowa Department of Health and Human Services, as well as CDC vital statistics, if you're interested in that rate. And just want to call out that in addition to just a downward trend, the Iowa stillbirth rate for Black expectant parents decreased by 39% in the first 5 years of our program.
Okay, so now switching gears just a little bit, we would like you to meet Baby Save Alex, and Alex is from California. And just want you to hear a little bit about his story. Alex's mom says, on the Friday prior to my induction, I sat down to count my baby's kicks. I had found the free Count the Kicks app when searching the App Store and used it regularly to help me track my baby's movements. Typically, it would only take my son a few minutes to get to 10 kicks. But not this time. I laid on my left side and still only counted 2 kicks within a 2-hour window of time. I was scared and went to the hospital thinking something bad was happening with my baby. I knew waiting until Wednesday could be too late. I tell every mama to be my story and about how Count the Kicks saved Alex's life. I'm forever grateful and thankful that I listened to my instincts and counted the kicks. So we're so grateful to Alex's mom for using our app and to bringing him to his family safely. And our goal is to replicate that strong stillbirth reduction rate that we've had in Iowa, in your state, and in Fresno County. And this is how we do it, by sharing our Count the Kicks educational materials with every expectant parent in your community. So we're giving away a $50 gift card to a lucky random person who orders Count the Kicks materials during this webinar and who couldn't use an extra $50. So at this time, we're going to give you a couple moments here to go open up a new tab, go to counttthekicks.org or scan the QR code on your screen and search for order materials on the top line of the website. You'll also be able to click on the state of California and there'll be a drop-down menu for Fresno County. And there you'll see the materials that are available to you in English and Spanish. And we also have picture-based materials in Hmong. So go ahead right now. Put your orders in for those posters, app cards, and brochures, and we'll give you just a couple moments to place those orders.
Yeah, and I don't want to play music. So I don't want to blow everybody out. So we'll give you some quiet processing time. I'll go get the link for your store just in case you don't see it, and we'll let you place those orders right now. Hybels beat me to it, you guys. I wish we had some music. Doesn't that? We just need some music right there.
I know, it's just not the same, is it?
Not the same. It's not the same. We want to give away those gift cards, so get your orders in. All right, Hebbles, you want to keep them moving?
Sure. All right. So I'd like you to introduce you to another baby save. This is Mabel. And Mabel's mom, Megan, said that the only red flag that there was a problem with my pregnancy was my daughter's change in movements. I am so grateful I had the concrete data from the Count the Kicks app, which gave me the knowledge that something was off and the confidence to advocate for my baby. All moms deserve to have this knowledge so their babies can have a healthy birthday too. So we're so grateful for Megan for counting the kicks, and look at that sweet face on baby Mabel. Just so grateful that she's with her family safely.
All right, so I mentioned that Count the Kicks is the best practice, and here's one of the places that you can find information about that. If you're familiar with AMCHIP, which they're coming to California, and Hybels will be there too. If you're going to that conference, please come and stop by. But AMCHA named this as a best practice in 2021. So there was a scientific review that was done. They looked at the material and they determined that our program meaningfully engages stakeholders at all levels of practice and ensure that improving health equity is an integral component of overall program sustainability. So we're really proud of that designation. We recently, for those of you who might have nursing experience, had an A1 pathway released, so about fetal movement monitoring. And so we are happy to provide any kind of information about that to you. If you're curious about that, you can email either Hybels and I. And Hybels, do you mind putting our emails in the chat while we do that? All right. So we'll keep on talking a little bit more about research. So a study out of Des Moines University and the Harkin Institute took a look at our data from the app users that we have. And they were able to find, with a scientific study, that there was no increase in anxiety among the vast majority of Count the Kick app users. In fact, one recent study showed that 85% of app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious because they were using our app. And I just want to make a plug here for those of you who work with expectant families that might have other children. This is totally, when we get to the kick counting, there is totally a way to do this with young children and have young children participate. And so definitely bonding between the expectant parent and baby, but also through that family relationship. So just want to highlight that for you.
Okay, so now we're going to switch gears a little bit to how to have a movement monitoring conversation with the clients that you serve. So why does movement matter? Movement is one very important way that baby communicates before birth. A change in a baby's movements can be an early and sometimes the only warning sign that the baby is in distress. So just like when you and I don't feel well when we have a cold or the flu or COVID, our movements become less, we're not participating in our daily activities and responsibilities. And babies are the same. Their movements become weaker during a time of distress. When they're not feeling well, the baby will naturally preserve blood flow to vital organs like their brain and heart to conserve energy and self-protect. So what movements count and when should we begin counting? So ACOG recommends beginning counting movements at 28 weeks of gestation or 26 weeks if considered high risk or pregnant with multiples, because this is when research has indicated that baby has established a consistent movement pattern that the expectant parents can feel and track. And then what movements should be counting? We want those parents to be counting rolls, kicks, jabs, swishes, punches, pushes, really anything except for hiccups, because hiccups are involuntary movements. So then how do you have this conversation with the expectant parents that you serve? Here's a 1 through 5 step way that you can have that conversation. So number one, we want people to download our Count the Kicks app. They can use that app to monitor movements. We also have a web-based kick counter. We also have paper movement charts that you can download that we'll put a link to in the chat here in a moment. And we want expectant parents to be counting baby's movements every single day in the 3rd trimester, preferably at the same time when baby is most active. And then we want them to time how long does it take their baby to get to 10 movements, and then rate the strength of their baby's movements. And then after a few days, they'll begin to see the average amount of time that it takes their baby to get to those 10 movements. It's really important to understand that every pregnancy is different and every baby is different. So even one parent that's had multiple pregnancies, one baby could take 4 minutes to get to 10 movements, and the next baby could be 30 minutes to get to 10 movements. So we want those parents to know what is normal for their baby in order to know if something is off, and then feel empowered to call their care provider right away if they notice a change in the movements or the strength of the baby's movements. So our Count the Kicks app, let's talk about that. It's free, it's easy to use. Again, it's available in 21 languages, available on Apple and Android. You can set daily reminders to count the kicks. You can count for a single pregnancy or for multiple babies. So how you count the kicks is you want, again, to start counting at the same time every day. We want expectant parents to become registered so they're able to save their data through the app. So we want them to find that same time every day when the baby is most active. And when they feel that first movement, they can go ahead and tap the blue footprint. That will start the timer. And each time they feel a movement after that, tap the blue footprint again. And after 10 movements, the timer will stop. The app will ask the parent to rate the strength of the baby's movement, and then the app will produce this graph that you see on the second phone that's in pink and red. So you can see this baby has an average length of time that it takes about 15 minutes to get to those 10 movements. Think of this as kind of like a data download for expectant parents' intuition, and they can also use this data and actually download it for providers or family members. And again, if somebody doesn't have access to internet, to a cell phone, they can use our web-based kick counter if they're able to access a computer at a library or a friend's house. And again, we also have the paper kick counting charts, and there is a link for that in the chat. And now let's watch a quick video to see how easy it is to use our Count the Kicks app.
Whether you're counting on the go,
आराम से घबराइए मत.
your baby's movements matter.
Les mouvements de votre bébé comptent.
Monitor your baby's kicks, pokes, jabs, and rolls once a day.
Todos los días durante el tercer trimestre.
C'est l'occasion de communiquer avec votre bébé et d'apprendre ce qui est normal pour lui.
Bond with your baby.
Crea un vínculo con tu bebé.
सशक्त महसूस करें. Sentez-vous autonome.
Confía en tus instintos.
Trust your instincts.
Ve al hospital de inmediato si los movimientos de tu bebé cambian.
L'application gratuite Count the Kick est disponible dans plus d'une douzaine de langues. Application download करें
Or visit counttthekicks.org for more ways to count.
देर ना करें. आज से ही गिनती शुरू करें.
No tardes, empieza a contar hoy.
Ne tardez pas. Commencez à compter aujourd'hui.
Don't delay, start counting today.
Okay, one other resource we'd like to highlight on our app is our Find Local Resources page. If someone becomes a registered user, they can search by zip code for free and reduced cost services in their area, like diaper banks, mental health services, dental care, and WIC clinics. So when we connect people with resources like this, the chance of the baby having adverse childhood experiences can decrease. And this resource is completely free for our app users.
All right. So we're going to switch it back to me now. And I've launched a Wonderings here. I'm just curious if you want to take an opportunity, questions or Wonderings, whatever you call it. But we would like to understand what kind of questions you receive about fetal movement monitoring. And maybe you haven't gotten them quite yet. Maybe you can anticipate them. Let me share with you some common misconceptions, some common questions that we hear, and what our response is. And that would be the reason why I'd love to get some feedback from you on these questions. We're always looking to update this and to have information so that you are ready if you get asked those questions. We push that out in a frequently asked questions guide. We just want to give you some support in answering questions. So here is one that we hear often, is that, and this is a little bit outdated, my baby should get 10 kicks in 2 hours. So this used to be kind of the gold standard when I was in nursing school, previous to the year 2000. This is what I was taught in maternity nursing, is that we were looking for 10 kicks in 2 hours. But current research indicates that parents should really work to understand the normal amount of time each day it takes for their baby to get to 10 movements each day. And so that's why sometimes I feel like a broken record, because I say, you want to do this counting at the same time every day for every pregnancy. So that's another myth that we start to hear is after somebody has experienced one pregnancy, well, I know what movement is normal. And that tends not to be the case. When somebody gets really concerned, I haven't felt my baby move, and they're just not as familiar with the patterns because they haven't been paying attention to that movement. So that is something that I'd like to just highlight for you. And we have recently, through our social media, put out quite a few instructional posts about that, just about that fetal movement monitoring in subsequent pregnancies. So here's another one that we hear. And this, again, I remember learning this in nursing school. So if my baby isn't moving, I should drink something cold or eat something sugary to get moving. And here's the key to this. Again, research has moved away from the idea that sugary drinks are a good way to get baby moving because it's a false representation. It's not what is true about how your baby is moving. So this is an intervention that is applied, and we act differently. We react differently when we're giving something to make us move along. It's like when we're tired, a lot of people will drink caffeine. They'll drink, a Mountain Dew or a coffee or something. That's not really a representation of how they would move normally, because now they've got the caffeine and that's kind of accelerating how they're working. So just so you know that is a misconception, and we do want to combat that information, and know that people should speak up to their provider right away if they start to notice that something is not right, if something is off in the movement. So this is Jen Hamilton. She's a pretty famous social media influencer in the OB world. She is a nurse. She's going to introduce herself. And we just want to highlight that she talks about a couple misconceptions here in this video. And let me just share that for you right now.
Did you know that there's an app that can prevent stillbirth? Studies have shown that the most reliable indicator for an intrauterine fetal demise or stillbirth is a change or decrease in fetal movement. Getting to know your baby's movement and letting your doctor know if you have any changes is a great way to protect your baby. You don't need an at-home Doppler, and in fact, I would highly discourage you from buying one, because sometimes what happens is you can notice a change in your baby's movements and you can put on the Doppler and hear a heart rate and be like, whew, everything's fine. And if you were put on a monitor where we could see what your baby's doing, we would see fetal distress. This is a baby that's doing great. This is a baby that might not be doing great. And this is the baby that's definitely not doing great. But guess what? Every single one of them has a heart rate around 150. And with just hearing a Doppler, we don't know which one of these is your baby. There's a free app that you can download called Count the Kicks. It is a way that you can monitor your baby's movements, and it'll help you figure out if you might need to go get medical attention. I don't work for Count the Kicks. I get $0 for telling you about this. I just think that this is genius. They were able to decrease Iowa's stillbirth rate by 32% in the first 10 years of the Count the Kicks campaign. So please, take a few minutes each day and just pay attention to what your baby's doing. And if your baby's doing something wonky that they haven't normally done before, come see us. We would so much rather you come in, we monitor your baby, we maybe do an ultrasound, and we let you know that your baby's doing okay, than for you to not come in and your baby not be okay. You aren't bothering us, okay? We want you to come in. That's what we're here for.
So again, that's kind of parent facing, but it's really good information for us to be aware of as we're working with expectant parents, and dispelling some of those notions, and also just the encouragement to speak up. And that's what we really want to hope that you are taking away as someone who works with expectant parents, is that this tool, this campaign is designed to help parents speak up, and it's designed to empower them, especially when we are counting using an app or a paper kick counting chart, whatever that may be. It is designed to empower them to have that conversation with their provider. So we really, really, really want you to understand that today. And I'm going to leave some time at the end. There's some really excellent things that you guys put in here in the wonderings that you had. So I'm going to leave time at the end to address them. But we want to talk about next steps and what's coming and available for you. So next steps, you've heard this information. We want you to download the app. We want you to practice using it. We want you to be able to, there's not much to troubleshoot, but sometimes there is when people aren't familiar with technology. So just to familiarize yourself. I was in another state doing a conference, and we spent about 10 minutes making sure everybody knew how to count for twins, because that is a little bit of a learning curve. So make sure if you're working with expectant parents, you know what's going on and you know how to kind of talk through some of the things that an expectant parent is going to see on the app. We want you to order materials. Again, we are giving away those gift cards. We want to send them out. And so get those orders in. I'll put this barcode up here again in a second. But also make sure that someone's designated to keep an eye on the materials that are available in the office or practice that you're at, and don't let them run out. Make sure that you have the opportunity to educate parents and you have the materials that are there. So taking time to educate. I saw we had some WIC visitors, and something that's been shared with us from other WIC clinics across the United States is just having the poster behind them in a room where they're having a counseling session is a great way to open up the discussion and say, hey, you know, this is another thing you could be doing during the third trimester. It's really a great opportunity for you to bond with baby. And so just making that a part of that conversation is really an important step. Make sure everyone that's working in your office knows about Count the Kicks and the importance of tracking fetal movement. We're going to share out a recording to this webinar. We're going to share those slides. Bring it up in a staff meeting. Hey, did you guys know that this is available? And it's super easy, because not only may you be working with expectant parents, you might just be interacting them in family situations and social situations. And this is a great opportunity to get that information in front of them. Then debunking misconceptions and encouraging speaking up. Sometimes we just have to say, you know, grandma said, drink a cold drink, but, you know, really, if you've noticed a change, let's go ahead and call your provider. So think about ways that you can have those conversations with individuals when you hear myths, and send those to us. If you're not sure what to say and you heard something, send them to us. We may not know the answer right away. There's a really great question here in the chat that I'm going to get to. Thank you, Sylvia. I don't know the answer right away, but I'm grateful that I have the opportunity to go and learn more about it. So, and then finally, remember, hours and minutes matter when preventing stillbirth. So we need to educate our parents how to quickly get to their doctor. In Fresno County, maybe that's a conversation. If you are interacting with providers, ask them what you should be saying to people if they notice a change in movement. Do you want them to come straight to the hospital? Or do you want them to call? Do you want them to wait if they don't get a call back, you know, for an hour and then go to the hospital? Just know what to say to the expectant parent so that they know, because that matters. Minutes matter in preventing a stillbirth.
Okay, so switching gears again, we're going to talk about some additional resources. So again, coming back to our free educational materials, we have our traditional materials, which are brightly colored with yellow, more text-based. Those are available in English and Spanish. And then we have our at-a-glance materials in English and Spanish and Hmong. So those are picture-based materials that we've created with health equity and health literacy, because that is at the center of the work that we do. So these materials are heavy on pictures and offer a very visual way for people to understand our program and why paying attention to movement in the third trimester is so important. So again, don't delay in placing your order today during this webinar.
So we have an opportunity. This was just newly updated, our Count the Kicks training. So, you know, somebody mentioned that this might be something great for their staff. This is another opportunity, especially if someone's really interested in the research and kind of getting into the weeds of fetal movement monitoring. This is a great opportunity, and you can get those CEs. So very low cost to do this activity. You can scan this training code there, and you'll receive a continuing education certificate upon completion. So that's another resource that we want to just highlight for folks today who are interested in fetal movement monitoring. So we'd like to share a story from a parent with you. And this is kind of one of the last things that we're going to do today. And then I'll share just some of those answers to questions that you had.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously. Like, it's your baby's life.
So we want to encourage you to follow us on our social media channels. Just a couple distinctions for you. The Healthy Birthday channel is a little more centered on the advocacy work that we do and the work that we do as an organization. Some of the health equity topics that we cover are there. The Count the Kicks channel is more parent focused. And so there's a lot of content that is there that answers questions, responds to questions, very expectant parent centered. And so please use both of those social media accounts. But when you're working with parents, they might be a little more interested in the Count the Kicks Facebook account or Instagram account, whatever it is. And then finally, our newsletter is a great resource. It'll let you know about new things that are coming, information that's dropping if we have changes in materials. This is how we communicate about the work that's going on, and you can see those updates. So in closing, we want to once again thank the California St. Agnes Medical Center for being our partner here. And Helen, we're grateful that you're here today with us. I'm looking over in the chat. I saw that she said hello. So very grateful for that partnership that is provided so that we can have these materials get in your hands. We will have an opportunity to connect with you about the materials that we use. So I want to get into some of the questions that were submitted. And if you are ready to go, you've got what you need, you're welcome to leave us. I'm actually going to drop off here and stop our